City Cat. Hey, we survived.
We did.
Barely, but we did it.
Survived what?
The week.
Oh, yeah. yeah.
How's your weekend?
It was good.
What'd you do for 420?
I listened to Fish and I ordered more CBD oil.
But you weren't high.
No, but I found out that you actually don't need a weed card in California to just go and get some weed, so I'm about to do that on my ride home today. You still have to use cash though, right?
Well, I feel like that would be inefficient. No one carries cash anymore.
They all used to be cash only.
What?
Mm-hmm.
Why?
I think it was before it was... I wonder. I'll go check tonight.
Maybe because so many people were trying to put weed on their credit cards that weren't, like, credit cards. Like you know, they were over the
I don't
limit.
know if it was to protect the customers or if it was to protect the store. Something like that. I don't know.
So you're taking up smoking?
Smoking, yeah. I'm not drinking for a while.
Oh! Was that... I wondered.
Yeah, I actually talked to a couple people about it, and you really shouldn't mix alcohol and Prozac.
Imagine that. You know what, though? Because, like, I feel like that's not your fault, though, because we're taught, like... oh, you shouldn't drink when you take an Advil, or like you shouldn't drink when you're on antibiotics. But then you have other doctors that are like, yeah, but 1 or 2 won't hurt you.
Right. But I think for sure that's why like I was still drinking anyway. But then, you know, taking a little inventory, I've gotten into a fight almost every time I've gotten drunk. And it goes from being like, because I used to be able to put them away.
Yeah, I watched that happen.
I used to be able to like truly just drink and be like, I'm fucking fine.
Yeah.
I would just get a little bit drunk, but overall I would be fine. I would never black out. But now it goes from being like a little tipsy to full-blown blackout. So
and then that's medication too. Like
yeah, so I'm just not going to do it. And I don't like who I am when I'm drunk like that. So I'm just going to... I smoked a little weed this weekend, and that was nice.
What do you think the difference between like this time? I feel like I always do that thing where I go like, I'm going to do 30 days. Like I'm just going to do a cleanse, and then I always find a reason to drink. Like what are your tips to like, I don't know, staying strong? Is it just take day by day?
I guess. I mean, I normally when I would say I'm not going to drink, it was usually to like it was more like surface level stuff, like, oh, I'm going to save a bunch of calories by not drinking, or, oh, I'm going to see if I could do this or whatever. And those things I don't care about so much as I just don't like who I turn into when I drink.
It's also crazy. Like, I thought peer pressure was just something that happened in high school.
Oh,
and
no.
It wasn't until, like... But then, because then the word peer pressure makes it sound like it's mean. Like, you're a fucking loser if you don't do this. Whereas an adult, it's like, come on. Don't make me drink alone.
Yeah, it's that.
It doesn't feel as severe.
Also without people even saying anything. Like, if you're going on, like, a meeting or something like that and everyone is getting a beer.
Drinking. Yeah, it's one of those things. I mean, shit, I think it's always good to give your body a break from any kind of substance.
Yeah.
Even, you know? Fucking, I did that shit with the birth control. I was on that shit for 12 years, and I know that that's not good for your body to be on for that long. And so just take a break. Take a break. Guess what? You can always drink again.
If you can.
You can always drink again.
I know that. Like, I could, it's not like I'm being rigid or having a certain amount of days or whatever. I am taking it. I would drink to hide. Like, I drink or even eat or whatever, like, to hide behind things. And as it turns out, I just have to be, I don't want to keep doing that because eventually I'm going to wake up and I'm going to be fucking 60 and I'm going to be like, why did I hide?
I'm proud of you. I think it takes a lot to, because you've noticed patterns before, but it takes a lot to go beyond the reasons you've used before. You know, like, oh, well, I didn't want it, so I did. Or like, you know, I think this time it feels different. I think that's good.
Yeah.
Good on you, buddy.
Thanks, buddy.
Proud of you.
Thanks.
What are you going to do when you feel like drinking? Read a book? I only asked because I read a book once that was like, you know, instead do 5 insteads whenever you're trying to quit something.
Well, it's not like that for me right now. It's not like I'm like, oh man, I have to quit. It's truly, it's like, oh, I'm identifying that this thing is I don't enjoy it. So it's sort of like, what are you going to do when you want a slice of veal? It's like, I don't want the veal. You know what I mean? Like,
very specific.
I was going to say mushrooms, but that would get confusing because of drugs, because I really want to try mushrooms.
Oh.
Real bad.
Man, I don't.
I so badly want to.
I think there's something too. We know a lot of people that microdose. It's the same thing as like people taking THC to treat different sort of invisible illnesses. And there is a way of like microdosing helping. There's studies being done, science being done right now that's helping it. One of the forefronts of it helping things like bipolar disorder or PTSD, anxiety, and it's something where you don't actually feel the effects of the hallucinogenic.
Yeah, I mean, I really like CBD oil right now. I didn't think I liked it at first.
Remind me to order some.
Oh, I ordered some for me.
Oh, good.
For myself.
The Charlotte's Web?
Mm-hmm. I ordered some Charlotte's Web. And then I also ordered, because I've been listening to Pete Holmes' podcast, which I told you guys about. He also talks about Alpha Brain, which is like an all-natural plant extract that isn't like a cup of coffee, but it just helps you focus. And he's been taking them for like years. And it's one of his picks.
I've never even heard of that.
I mean, I'm sure that he like is sponsored by it, but I know that it's one of like his actual picks.
Yeah.
Kind of like how we have our picks at the end. He does them in the beginning, but he made it sound so good, so I went and got it.
You did? Have you been taking it?
I ordered it, so it's probably going to be here like this week.
I did this thing that it's going to be for an Instagram post, but it's this thing where you take a quiz online, and it goes deep. It goes into your, like, issues as a person.
Yeah.
And then it forms all-natural vitamin packs for you that are, like, specific to you. So I just started them yesterday. It's like, I said, obviously, like, I drink a lot, and I have, like, anxiety, and I have memory issues just because of, like, all the nerve medications I've been on all my life, but it specifies and it does like specific pill, like it's not pills, it's vitamins like for you. So I'm interested to see if I start pooping better. Yeah.
Interesting. Probs.
I
feel like I've been pooping shreds this weekend.
Well, we also did a lot of drinking last week, and I feel like it takes a time to get. I know. It's
I'm wearing
hard.
the same shirt I wore last weekend.
But it's a great shirt.
Well, it's Garrick's last day today,
and
we did Hawaiian theme. Hawaiian print, so I feel like this is pretty.
You're like sexy Zara Hawaiian.
Thank you.
You're welcome.
This is ASOS.
I did not get ready at all this morning.
So you went to the gynecologist.
Yeah, I mean, I guess we can get into it. It's our sort of topic for the day. We're going to also answer a fan question later, but I have talked a lot about my vagina here. You guys know about all the issues I was having with birth control, and I was deciding to kind of get back into taking some form of it, and I wanted it to be non-hormonal. And then I was having a lot of weird shit go down. And I'm not talking about like yeast infection, UTI. I was feeling like pain, fucking bleeding for no reason, and not like spotting bleeding. Like I would have to sit on the toilet and just let myself bleed out for 5 minutes until it kind of stopped. And I was like, I kept telling myself it was just coming off the birth control. And finally I was like, I gotta go to a fucking gynecologist. I was so bloated, and the lady was like, oh, you need to go get an ultrasound right away. So I went this morning, and the ultrasound tech was like, I'm really not supposed to tell you anything, but you definitely have fibroids, and there's some cysts on your ovaries. And the cysts aren't really anything to worry about, because like a lot of women actually have at least one cyst. That's kind of like a trademark of having a cervix or a uterus. And it's just a matter of like if it becomes problematic. But the fibroids are something that are a little more alarming just because...
Is that why they used to call it, or that's why Trump was trying to call it a pre-existing condition?
Yeah.
Being a woman was a pre-existing condition.
Fucking A. I mean, like, honestly, maybe. Like, who knows what women's health expert is whispering in his ear all day.
Some dude who's like, I saw a pussy once.
I saw it, and it was... Whew.
That bitch was, It's like, that's the guy giving her.
Yeah, okay. I wouldn't be surprised. But we talk a lot about it at BuzzFeed within the women's group that we have here. And a lot of women actually do have fibroids and are completely fine and live completely normal with it. And then another alarming statistic is 70% of black women will have fibroids in their lifetime. So they were giving me all these updates about like how alarmingly common it is, but it only gets bad if it gets big, and it can get like cancerous, I guess, or it can just be like hella fucking painful and turn into polycystic ovarian. It could turn into a whole bunch of stuff. Anyways, so I was in a bad mood this morning just because it's like sometimes I just feel like, when am I gonna get a fucking break? Like it's like finally I'm starting to feel good about the jaw pain, or like finally my anxiety feels good, and then it's just like another fucking thing, and then I feel like, well, I shouldn't complain because I have it so much better than so many people, and like, I don't know. We've talked about it before, but like if fibroids were a man's issue, this shit would have been solved eons ago. So it's it's good that's happening because it's opening my eyes also to something that a lot of women deal with and making me realize like how lucky I am that I find, even have health insurance, that I find it early, that I'm taking care of my body.
It doesn't mean it doesn't suck.
It does fucking suck because it's like now every time I have sex, I'm bleeding profusely like a stab wound.
Damn.
It really brings a new meaning to the word axe wound. So I figured today we could maybe talk a little about the gynecologist, what that means, how it goes, what to expect, what not to expect, maybe some stories about the times. I mean, I'll tell a story about the time I've been. I don't know if you've had anything exciting happen at the gynecologist.
No, never exciting.
Didn't you go for the first time
last year?
Yeah.
Yeah. I'm actually due to go again. I have to
go again.
Yeah.
I started going to the gynecologist when I was 15. The guy knows the vag doctor, by the way, OBGYN, someone that deals with all things vaginal or boobs, I think. Female hormones. I don't know what the dictionary.com version says it is. But first time I went, it was because I secretly was having sex and I hadn't told my mom yet, and I wanted to get on birth control. But then my mom was like, I'm going to take you to the gyno. And I was like, oh, fuck. Okay, she'll take me, but maybe she won't go in the room with me. So then my mom went in the room with me, and I was like, fuck. And I was just scared because I also didn't know what was going to happen. Like, was she going to go inside of me? Was she going to just talk to me? And so when I was filling out the questionnaire, it asked, do you want to be tested for STDs? And I put an X in between the yes and no boxes. And so the gyno came over and goes, what's this? And she like hides it from my mom. And I was like, well, and I like kind of pointed, and the gyno, she beautiful, sweet Dr. Gyno, you know who you are. She literally went, right, mom, out. And my mom was like, what? She's like, get out. You don't need to be here for this. And I was like, oh my God. And I was like, well, I'm nervous because I'm having sex and I'm not telling my parents. And she was like, well, you don't need to tell them. It's none of their business unless, you want birth control. And then, you can get it from Planned Parenthood. You can get it from me, da-da-da. She gave me her personal cell number. And I was like, okay, but now what are we going to tell my mom this conversation was about? And she goes, well, I'll just tell her you saw an ingrown hair or something and freaked out and wanted to get it checked out. And I was like, what an amazing, seasoned gynecologist. Like, she fucking saw that I was scared. She walked me through it. She told me all of my options. She told me I didn't need my parents' permission to be doing any of this stuff. And when you're on someone's health insurance, you feel like obligated in a weird way because they're going to be getting the bills or whatever. But there's so many resources that she told me were available. And I don't know. I just thought that was such a good place to start with, like, my relationship to someone that goes inside of me that isn't a sexual partner.
That was good of you to go to the gynecologist.
I didn't know what else to do.
I avoided the gynecologist for years.
What was that?
Boy. Oh boy. I mean, A, I wasn't sexually active. B, I've never really, like, I don't know. I just...
You didn't need to?
I mean, I should have gone, like, as an adult woman, you gotta go. But I just didn't. I was too, like, I don't know if I was too scared to go or if I was just too, like, oh, I don't have a vagina.
I'm just going to ignore this completely.
Yeah, just because any sort of, like, need, that was just across the board, though. Any sort of need, any sort of, like, anything, I would just ignore.
Do you do that with, like, I don't know, like doctor checkups or like dentist appointments? You just kind of go like, nah, it'll happen when it happens.
Yeah, like, I'm fine. I think I'm fine.
Yeah. I think they say once you start menstruating or like start having a period that's like when you should start going, because then that's when you should also start getting like your pap smears regularly and your breast exams. And so, so some things to expect when going to the gyno. Boy, oh boy, go early. Go at least 20 minutes before your appointment because, baby, you're going to be filling out some paperwork. Even the place that I've been going to for like 10 years, every time I went, I had to fill out some new form of some new law had gone into effect or some new pill was an option. It's like...
Oh, really?
Yeah, every time I got... Or like my insurance had changed and it was like, just go early.
Oh, I remember people would be like, it's going to hurt. Like when they do a pap smear, like it's going to hurt. And they're like, it's like I just remember people telling me that they would like, it was going to hurt and then they passed out or something like that. I went,
Jesus.
And she's just up there fiddling around. And at one point, she's done and she's like, okay, we're all good. And I was like, no, I needed a pap smear. She goes, babe, that's what it just was.
Oh my God. So you didn't even feel it?
Mm-mm.
See, oh man, I felt pap smears where they go in and they put what's called a speculum. A speculum? I don't know what the fuck it's called. It basically looks like gardening shears, but they're rounded and soft.
It's kind of like a tongs, like for a salad. Sure, I'm so tired. It's like salad tongs.
Yeah, it just opens the puss wide up, and then they take a little tiny brush and they kind of...
I felt that.
Scrape the inside. Oh, God, it sounds so bad when you scrape it, but that's what they do. They collect the cells from the side, and they just test everything to make sure all your cells look normal.
Yeah.
So you can, if you're going to get a wellness exam, which is what that's considered, then you're usually you should expect someone to be going inside of your body and then also doing a breast exam, because that's also just really important to do. Even if you don't do it at the gyno, you should do it yourself. So that's definitely something you should also expect. And you should also expect to get like your height and weight and measurements done, because it is also kind of like a regular doctor's office. Like they don't just say like sit up on a table. They also check like,
oh my God, I remember going to one doctor. It was so fucking annoying, truly awful. I like went in and she comes in and I'm like, hey, do you mind if I don't get weighed? Like I'm currently in the middle of eating disorder treatment. Do you mind if I just don't look at the scale? And she said, honey, this is Beverly Hills. No one wants to look at the scale.
Oh,
and I'm like,
no.
Oh, please fuck off.
Also, going to the gyno Beverly Hills, that's
nice.
No,
that wasn't a gyno. That was just a regular doctor. And she could suck it.
Ew.
Yeah.
Man, and you'd think being a woman, she would have been a little more sensitive.
Yeah,
to
so then I told her that I was on like Prozac and all that sort of stuff, and then she was like, she told me later when it had passed. It had passed. Like the conversation was over, and she goes, she's like, well, you know, with certain body types, clear out of nowhere, didn't ask. She goes, with certain body types, you'll never be super, super model thin. That's more for me.
What is she fucking even talking about?
Because she was super skinny.
But what was she even talking about?
Letting me know that my body type isn't supposed to be super skinny.
What? Is she a doctor or like a...
She's a doctor.
And that's in liberal ass fucking Beverly Hills.
Yeah.
The other weird... Oh man, I had a weird one once.
Let's hear it.
Okay, look, I'm not saying you shouldn't go to male gynecologists.
I'm sorry to yawn so much, man.
It's okay, we're just doing right in front of our salads.
Huh?
That's a saying. Right in front of my salad. You never saw that video that went viral where the girl's like, right in front of my salad? These two guys are having sex right in front of her. And she's eating a salad. She goes, right in front of my salad. I'll show you that later.
That's really funny.
I'm sure there are plenty of male gynecologists. My personal belief is I think you should have some... I just would prefer a woman.
Yeah, that's dealer's choice, man.
Yeah.
I remember we went to we went to FYF, and
That's a music festival?
Yeah, a music festival in Los Angeles. And they went and they had a line for guys and a line for girls to get like pat down. And I was like, can I just get, because the line for girls was so fucking long.
Of course.
And I was like, oh, I'm just going to stay in the line for guys because I don't care. Like, I know that it's a lawsuit on you guys are trying to, whatever. But then I was like, well, what do you do if someone's like non-binary and you literally have to be in one of these two lines?
I mean, that's literally like what they're dealing with just even being able to go pee.
It's crazy, but that, why did I say that? What were you just talking about?
Talking about male gynecologists.
Oh, yeah, that's dealer's choice.
Yeah, I think I'd rather just have someone that has experienced those things. And I'm not saying, like, I would only go to... Kate.
I'm sorry. That's why I would only go to a female therapist.
Yeah, well, I wish I could. I can't find one that I like. But, like, I'm not saying I would only go to a heart surgeon who's had heart problems. But I feel in this instance when it comes to something that's, like... specific to
also like your vagina reacts. Like
so
the thing spreads it open, like it's gonna react.
So this was the story I was going to tell you, is that I went to see my first male gynecologist because I had just moved out to LA, and when the nurse was in the room, I was like, oh, I'm on my period, so I have a tampon in, should I take it out? And she said no.
And
weird. I guess she thought maybe like we'll figure out what we're doing first before I make you like go to the bathroom. Like, let's figure out if we're just giving you an exam or what.
No.
So the doctor comes in and mind you, I'm like early 20s, so I'm not comfortable enough yet with my like stance on doctors to feel like I could give them any authoritative return in voice. But he was like, all right, scoot down and just take off your bottoms. And he stayed in the room, which I thought was weird. And then I got in the little like stirrups. Kate... He took my tampon out for me. It was I can still feel it happening. It was the worst feeling. I have never had anyone but myself take out something from my vagina except that man. And I don't even remember his name. It was the only time I ever went to him because I was so fucking bumped by that. And I just remember him like grabbing it, and then he held it by like the tail and carried it across the room like it was like a mouse, and then like dropped it in the trash can. And I just remember being like, are you fucking kidding me? I just felt so weirded out by that. Even though he's a fucking vagina doctor, I just felt so uncomfortable with that because it was something I had never had happen before. And maybe some people are okay with that, but I just sure wasn't.
Well, it's weird too because the vagina is just such an interesting thing. The way that we like talk about it, look at it, treat it, all of that sort of stuff is very interesting. For him, it's just
work.
Yeah, it's just like, oh, this is it's bleeding right now. You put this in there. Of course, it's bleeding. And so, you do what you have to do for it. But for a girl, it's sort of like, my purity. You know what I mean?
Like, I'm the only person that does that ritualistic act.
Yeah.
Now, of course, now that I'm older, I've like changed tampons in front of friends or like boyfriends or whatever, and I haven't.
But it's such a line. It's such a weird line.
Such a weird feeling.
Because also it's just like, it's not you reacting.
Yeah.
You know what I mean? And a lot of people with like actually trigger warning. Giving you guys a minute. Trigger warning. Anyone who has any sort of like assault or sexual misconduct in their past that has been done to them, there is like a really weird feeling where you're like, oh, I reacted.
Yeah.
I reacted because it reacts, and you're not the one being like, I like this. It's just like, kind of like you don't like being, this is probably not a great metaphor, but let's see. If you don't like being tickled, you're still laughing.
Right. Yeah.
You're like flinching, you're reacting, but you don't like what's happening to you.
I mean, it's like, people have written into our emails before being like, hey, I was sexually assaulted and I came. And it's like, that's not an incorrect thing. That's your body's physical response. The same way that
it's literally a reflex.
Yeah, the same way that like I was just so bumped by that because it just felt like an intimate thing. Not that I'm like comparing that to.
It's an invasion of privacy.
Right, exactly. And your body's gonna react. The body is a crazy fucking thing. The brain is a crazy fucking thing. And the first thing it will always try to do is protect yourself.
Yeah.
So even if it's like that can go down to just even why we have like anxiety about going to doctors. It's because you feel, even though these people are there to help you, it's still it feels like an invasion of your body.
It's like totally fine for doctors and medical professionals to look at it as, medicine and as their work or whatever, but I didn't go to medical school. No. I'm not there yet. That's not just an open wound, or I'm going to piss people off by saying that.
Yeah, well, you said it sarcastically. We got that you didn't mean it.
Anyway,
it's
I know it's a beautiful flower.
No, but I think it can be, if you have a bad gyno experience, it can be fucking traumatizing to go back to a gynecologist. So like, depending on your age, if you have resources to look into, there's different apps like ZocDoc or even Yelp where you can go and look at reviews on doctors. I know that they have like specific doctor reviews, but like do your research if you can, if you're lucky enough to have the coverage to choose your doctor. Find someone that you think you would feel comfortable with and read, and ask your friends. Do they have someone that they like? Do they have someone that they don't like?
Oh my God, what is this?
I'm just trying to fill space. The other thing that they're going to do is they're going to put their fingers up in you and feel your ovaries, which is always a weird feeling because they go up and like to the left and right, which is not something that normally.
It's just such a shitty experience.
I think it can be not a shitty experience, but you should know what to expect.
Just the whole time I'm like, because is there an equivalent? I know that guys have to get like a colonoscopy at one point.
And they have to hold their balls.
They have to hold their balls and cough. Yeah, I guess it's the same just when anyone is just checking your junk.
But this feels way more fucking invasive. I don't want to say that, but I did.
Well,
it does feel, because you're getting shit scraped and you're having instruments inserted inside of you, and
I'm just talking in
You
terms
have to
of
do
like
it multiple times a year.
Yeah, I'm just talking about in terms of like someone being close to something that's also very like in a lot of ways reserved for something personal and emotional.
Mm-hmm. Well, even like just ovaries are meant to drop eggs and fucking whatever else they do, but it doesn't feel good when someone's putting their little phalanges up there if you're not.
It's just so uncomfortable.
Yeah.
To me. I fucking hate it. It was like quick and easy, but I was just the whole time I was lying there. At no point was I like, I'm totally comfortable being just
I was
gaping,
gonna say
right?
my like, don't call yourself gaping.
I was in the stirrups and they put that shit in my vagina. I was just like,
I can't help but think of like gaping as like a butthole. What are you miming them putting their face in it? They did not eat you out at the gynecologist.
They eat you out at the gynecologist.
I fucking wish. It's like a
it's very.
I
I just didn't like it because I don't like the idea of being like, oh God, okay, think about anything besides someone's
breathing exercises.
Also, when you're not
really
sexually active and then someone's down there, your whole body's like, finally, and so you have to really talk yourself down.
I think I'm not kidding when I say like breathing exercises. It's like the same thing I do on a plane when I get nervous. I do the same thing or like I count the tiles on the ceiling. Or I try and relax because the more tense you are, the harder it's going to be for them to put anything in there, or B, get samples.
Did I tell you about the first time I got waxed? That I hit her?
Oh, yeah, you did.
I told you on this.
Podcast,
okay.
Yeah. Well, you hit your waxer because that was your body's reaction.
Yeah.
Hey, it happens. And you know what? I bet you that's not the first or last time she's going to get slapped.
I just feel like, I don't know, I fucking hate the gynecologist, but you gotta go.
You gotta go.
I'm tired.
The other thing they usually have you do is pee in a cup.
I love that.
Because
I always have to pee so bad.
Even if you're not sexually active.
I have to pee right now, and I could fill up a fucking trough, baby.
Ew. Don't say you're going to fill up a trough with your pee.
But I could.
I can't stop visualizing now. Just like a wooden, wet,
pee trough.
Pig trough that like it sloshes around.
Yeah,
when the
that's my
guy's
pee
carrying
sloshing.
it.
Yeah. No, you can just dump it out. Whatever, it's good fertilizer.
So they're gonna make you pee in a cup for a couple of reasons. To make sure you're not pregnant, even if you're not sexually active, they want to test your urine levels just for fucking UTIs, yeast infections. Well, I think they test yeast through your vag. Anyways, they're gonna test your pee. Kate's very tired.
I'm sorry.
The other thing is you shouldn't feel pain. You should expect to feel discomfort. It shouldn't feel like nothing. You know, I think people go in being like, it's gonna be fine, but like you should feel like you should expect that it's gonna be.
Expect that it's going to be a little uncomfortable, both emotionally and physically. I mean, it doesn't have to be. It's again, however you respond to stuff, but.
Yeah, like I'm used to it by now.
Yeah.
But even when that, today it's like a little alarming. It was scary, so my body was a little tense and it felt a little uncomfortable. But normally I'm just like, hey girl, yep, go ahead, get in there.
I would also just like to say that knowing these tips of being like, oh, this is what I felt too, this is what I felt, this is my experience. You could go into a gynecologist and not every doctor is great. Not every doctor is like very respectful or whatever. Not saying that most of them aren't. I'm just saying that no one's perfect, and you're allowed to like basically what happened when he took you know what I mean? Like you are fully able and capable and in your right to say this makes me uncomfortable. And if they shush you or if they say it's fine, like that's kind of, you are working as a free agent at that point, and you could just get up and go and go to someone else, and you don't have to be there even though it's wildly uncomfortable, because that's literally their job. And if you're uncomfortable,
then
you
they
gotta
might
tell
just be
them.
bad at their job.
You gotta tell them. You gotta be like, I don't like this, I don't like that. And if they're like, I know it's part of the, if they're like, it's part of the process, I'll give you a second, that's good. But if it's like,
if they're disregarding your feelings,
just be like, I know, like if they're disregarding, just be like, it's fine, it's whatever, honest, like.
Yeah.
You know when it feels like someone's being condescending.
Yeah. The other thing I wrote down is even if when you find someone you do like, don't lie to them. Don't lie to them.
They've heard worse.
And also, like, you're not going to shock them if you tell them, like, you're bleeding because you stuck something abnormal up there for sexual pleasure. You know what I mean?
Wait, did you ever hear the rumor? I feel like every elementary school or middle school had the rumor of this is terrible. It's terrible. You might have to cut it, but I'll just say it. Of like one of the gym teachers getting a hot dog stuck up her vagina
What?
and having to go to the ER.
No.
I feel like just because kids were terrible and whatever, but they would
They
like...
hated your gym teacher, it sounded like.
I just think everyone back home is homophobic. And anything that is like borderline or not traditional, they'll like make fun of.
Oh, it's the same thing as saying that someone got like a gerbil stuck up their butt.
What?
Wait, you're gonna tell me you've heard the hot dog thing, but you never heard the gerbil thing?
No.
The version of your story that Florida told was that
Florida, I forgot.
I guess the gym teacher put a gerbil up his butt to make it run around and make it feel good.
Man.
See, when you said the gym teacher with the hot dog, I immediately thought female hot dog in her vagina.
Yeah.
Oh, why is that homophobic?
Because they were saying like basic, I don't know. They were just saying it was about them being gay.
Oh.
Yeah.
Well, that's just...
Yeah.
Well, first of all, a hot dog would have no problem going in a vagina. It's a lot thinner than a penis.
But they break easy.
But it's not like it's going to get lost up in you. You never had to bear down and fucking fish something out of your cooch?
No.
I didn't mean that as like, well, then you haven't lived, because it's not great.
Sometimes I wonder if I still have a condom in me.
Sometimes I wonder if I have like a tampon in me from like years ago and I'm just not getting TSS.
That one, I feel like
Turns out it's just fibroids, guys.
Damn, I should go too.
Yeah, man, because it's good to just get it fucking checked. It's better to just do it. It's like going to the goddamn dentist.
It's so
because it's going to
annoying.
be so much more worse if you wait down the line and something has gone wrong and then you got to do all this shit. And like gynecologically, it's usually
Gynecologically?
Shut up. It's usually covered by insurance. So like they really have no reason not to go if you have a vagina. Even if you don't, like if you're dealing with anything female, you should
sort
be
of
going.
estrogen in your body.
Yeah,
it's good to keep
hormones, anything.
But if you don't, I mean, I don't want to exclude people who don't have health insurance. What's something they could?
Planned Parenthood.
Yeah, Planned
Go
Parenthood.
to fucking Planned Parenthood, and if you can't, get a friend to drive you out of state to go. There are options. Just whatever you do, do not go to like a seedy place. I've heard horror stories on other podcasts, even just about women that like didn't have access to feminine health care. And
I feel like Planned Parenthood, I know that Planned Parenthood is already like struggling with money and whatever, but I wonder if there's some sort of program someone could start
yeah.
What?
I know what you're gonna say.
What?
That helps people get to places where they
Yeah,
can't.
they go
have
pick
that.
them up. They do.
They do.
There we go.
I forget what it's called.
So
but
if you don't feel comfortable asking a friend or whatever, look online.
there's
Figure out how to
programs.
see if that someone could maybe come pick you up.
Or they
like a-
fly you like to an abortion doctor, because if you're in a state that like you can't, or like your age or religion or family, whatever, they have people that will come and help you.
Damn.
I wish I knew the name. I heard it on another podcast. Oh, balls, I'm just forgetting everything. Which is why I'm taking those vitamins that are going to help me remember some stuff. Anyways, I'm going to be fine. You should go to the gyno. Yay.
That's so fucked up. If it was a dude who like couldn't get a boner,
Yeah. That's why Viagra sells more than like any fucking...
and no one cares,
No.
it's just fine. But if
Yeah.
a woman doesn't want to get fucking pregnant or wants to get her cervix checked,
Ooh, yeah, the ultrasound
that's what's
tech.
great. So many people think that Planned Parenthood is just to kill babies,
No,
which is insane.
it's actually a very small percentage that is for
a
abortion.
lot can go wrong down
It's
there.
mostly for sexual health, so like birth control or STD testing, or a very small portion is actually abortion. But people listening to this know that. You
Yeah.
know? It's more like share that fact with your fucking... You know who's. The ultrasound technicians were kind of like walking me well. It was kind of funny because like they're not supposed to tell you things because they don't want you to freak out. Like they're allowed to diagnose you, but they're not allowed to give like definitive diagnosis. And I was like, because she wasn't making any noises or going like or anything. She just had like a fucking poker face. And I was like, so she looking clean or what? And she goes, oh no. And I was like, oh. She goes, yeah, you definitely have a cyst right here on the opening of your cervix. And I was like, oh, okay. But is that it? And she's like, and a fibroid. Definitely at the top of your uterus. And I was like, oh, but a pretty small one. And she goes, no, it's quite large. And I went, oh, okay.
What does it mean? Like, how do you even get rid of it?
So that's the thing is sometimes what they said it could have been was because I was on my birth control for so long.
Yeah.
The hormones were actually helping keep this stuff at bay.
Oh.
And so once I came off, it was kind of like a garden. It just started to grow shit. And the hormones were the thing that was keeping the garden like soiled up.
Dang.
Which is something that happened to my mom. My mom had that shit happen to her and they told her she wasn't going to be able to have kids, that she should just have a hysterectomy. Because it was like a fucking landmine in there. So it also is a little bit hereditary. So I kind of knew that's the other thing going in is when they I first started going to the gynecologist that my mom went to because it is also important to share your family history. So things like breast cancer, ovarian cancer, cysts, fibroids, PCOS, whatever. It's good to not lie to your gyno and tell them about these things so that you can also go, because it is really important, especially if you have that breast cancer gene, to be going like every 6 months to get your boobs squeezed.
Also, there are plenty of people who are, I mean, yes, that is important if you have your family history. If you don't, it's fine. Like
they'll figure it out.
They figure it out and it's totally fine. It might just be kind of like it's like a key. They're like, oh, okay, you have the key, great. If not, we could figure out a way to unlock this door.
Too. They can test you for the genetics.
So don't worry if you don't have access to that.
And your ovaries make noise.
Shut up.
Yeah, they make like it sounds like they're just swimming. Because she like clicked a button and all of a sudden like you could hear it on the speaker and I was like, is that my stomach?
Yeah, because it's your that's what happens in an ultrasound.
Yeah, so that's what I had. I had a pelvic ultrasound and then I had like an intervaginal ultrasound.
Baby.
Oh my god! And so that's the thing is they were like it would be alarming as if we opened this and we heard a heartbeat because then you're having ectopic pregnancy, which is when the uterus or the embryo gets stuck in your ovaries or uterus and you have to immediately go to the hospital. You have to immediately. Sometimes the women lose their ovaries. It's very like alarming. So she's like, that's every ultrasound tech's worst nightmare. Is if you do that and then you hear that, because then it's not a matter of like breaking the news to her about like having, an ectopic pregnancy. It's like, we need to get her to a hospital stat. And I was like, well, we're good there, right? And she was like, oh yeah, you're fine. I was like, okay, holy shit.
Jesus.
Now I see why they don't tell you things. Anyways, go to the gyno if you can. Please go. Let's do a fan question.
Yep. All right. The subject line is sex drives? More like high fives. Ha 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 ha. Seriously, please help.
Hilarious.
Hey ladies, like every fucking person, I love the podcast. I can't thank you guys enough. Blah, 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 blah.
Aw, thanks.
On to me being horny. So I've been with my girlfriend for 4 years, since we were 17, and pretty much everything is incredible except we have incredibly varying sex drives. She could and has gone months without anything sexual and never initiate sex. I've brought it up multiple times over the years, and for a few days afterwards, she tries to be more into it, but like always, it fizzles out. My ego gets damaged when she turns me down, as well as leading to me feeling like shit because she never initiates, and makes me think she doesn't want to have sex with me because I'm gross or not good, etc., etc. I would never force her to do anything, but doing anything more than communicating about it seems rapey. Yeah, okay.
She does.
When she does feel in the mood, she
goes first.
Because she never initiates and has multiple orgasms, but when it gets to me, it always seems like an afterthought, kind of like a pillow princess. But I feel like a pillow princess want to get fucked, and sex just seems like a thing that just happens to her. I love her with all my heart, but I want to have more than vanilla sex once every 2 months. I'd love to hear your thoughts. Okay. And they're not poly, so that isn't an option.
I'm going to just tell you what my initial instinct is. I don't think that's fair to you. I think if you're saying you're communicating, because a lot of times people will write in and say, I don't know how to talk to them about this. And I'm like, well, you just talked to us about it, and we're complete strangers. So it seems like you're communicating and she's not reciprocating, and you haven't mentioned anything about her with like past sexual history or sexual trauma. So to me, it just seems, with the way it's written, that you're getting ignored, and I don't think that's very fair.
Yeah. Also, if you've been together for 4 years since you were 17, a lot of people won't break up when you start dating someone so young because it just becomes habit, and like those are very, formidable years and like huge years really. So 4 years there it actually feels like much, much longer. And, sometimes you just get in a habit, you don't know how to break up with someone, but if you're not getting the sex that you want and you've brought it up and you're just not getting what you need in the relationship, it might be time to move on.
And two, it's okay to have a different sex drive than your partner. I mean, I would argue that like that is most people, because it's just, that's science, some stress and environmental conditions can make someone not want to fuck sometimes, and that's totally fine. You don't have to have the same thing, but if you're talking about it, there is different ways to sexually please you, and if she doesn't want to do any of those things, again, I think like Kate's saying, it might just be something where like now it's been habit for so many years. But there are other ways, like it doesn't just have to be sex. It could be like masturbating in front of each other, or like watching porn together, or like, I hate to say the word like spicing up your sex life, but you use the word vanilla, so fine, let's use spicing up your sex life. So I don't know if you guys have tried introducing other methods of orgasming into your relationship, but it sounds like, and two, this is a lesbian couple, so again, like you guys know that penetration does not equal sex in most cases, so I think that there is a way that you can introduce other things, but I also don't want her to feel like it's her job to have to carry this.
Yeah, man, I just think that, you're young, and, 22? And if you have a 21, I think. I think that if you have these needs and these wants, I think 4 years you've invested a lot of time and energy and love into this relationship, so for sure try stuff
if this is your person,
And if you want more than just vanilla sex once every 2 months, because I also understand, her side of being like, I'm not comfortable with it, or she doesn't really like it that much, or, whatever.
But it shouldn't make you feel bad or rapey, or as you say, like your ego's getting damaged.
I hate that we're saying rapey.
Well, I mean, that's what you said. But like that's a legit feeling. Like when you're doing something to your partner that, even though you're in a relationship for 4 years, if they feel like they don't want it, then that makes you feel bad.
I would just hate for you to walk away from or like to develop a problem from this, being like, starting to be scared of asking for what you want, starting to doubt your own sex drive, starting to, think that you're undesirable. These are all really big things that if this was, I don't know if this is problematic or not to say. I'm going to say it, and if it is, I'm sorry. But I feel like if you were talking to me about a guy, my first reaction would be like, oh, it kind of sounds like he might be cheating on you.
Ooh, yeah.
You know what I mean? And I don't know the same. That's all I'm saying is what I would say to a heterosexual relationship. I don't know if it carries over. I genuinely don't know. Yeah. But basically, regardless of whatever type, whatever your sexual orientation is, I think that if you're not getting what you need to be happy and fulfilled, then the relationship is lacking.
And she could also be like asexual and not know it, or like there could be something where like she just doesn't like having sex, which is fine, but if you're going to be in a relationship with her, I don't think it should have to be her job to like figure out why her partner doesn't like sex.
Yeah, I feel like regardless of, I think that's also kind of a dangerous slope to go down. Like you have to take care of you, and you have to make sure that you're good and let her take care of herself. Because if you start thinking like, well, she's uncomfortable with this, so I'm just going to be patient about that for a while. It's like, who's looking out for you?
Yeah,
who's making sure, because
who's making sure you come, and you can only do yourself like so much. Like there is an intimacy like with another person, another body. It's like, oh gosh, so I get, what did we sort of answer the advice or answer the question, I guess. Like I think there also isn't enough explanation on why she doesn't want to do it, besides it just seems like it's a rut. It seems like a 4-year kind of like routine thing that maybe, so I don't know if maybe my advice is to, if you feel emotionally available, to dive deeper into why she's not feeling it, then maybe. But I could understand too. It's the same thing when you confront someone about their drinking. They'll go like, "Well, I don't have a problem with drinking." It's like if you confront someone about something really like personal and intimate like this, they might get defensive. So my advice is split. I say try and help her figure out why maybe she is, adverse to sex with you specifically, or if it's something that's a greater, larger, I don't want to say issue because it's not an issue, or just a greater, larger situation.
Yeah, man, I would just bring it up, ask what's going on, and just be honest with both her and yourself about what you need and what you want to be happy, because just because you've been doing something for a long time or been in something for a long time doesn't mean that you have to stay there.
Boom. I like that.
Yeah. So,
think about what you want.
Because you could just be like, well, we've been together for so long, we'll figure it out, and keep repeating the same pattern of talking about it, and then it gets better for a couple days, and then it goes another couple months, and whatever, and then before you know it, you're like 7 years in, and you're like, oh no, now what? And you live together. It's just...
There's just cobwebs coming out of your vag.
Just bring it up.
Cool. I hope that helped. Thank you so much for writing in. We love you too. Do you want to do our things of the week? I still don't know what we call this segment. Kate and Kelsey's adult things. We both had books this week. Yeah, sure. Mine is a fun fiction by Daniel Handler called The Basic 8. And I read it in like a week, and it's quite a thick book, but it was that well.
I read it in a week, and it was like pretty thick.
No, I meant like that's how good it was. That it was
I read a thick book.
It was
real fast.
THICC. You know what I'm saying? It's like Gossip Girl meets a true crime, and I know true crime is so hot right now, and I fucking live and love and would die for Gossip Girl. So if you mash those two things, you get The Basic 8 by Daniel Handler, which is crazy because the main character is a female and he is a male. So I thought, what an interesting way to write a female character. Anyways, I liked it. What's yours?
Mine is a book. It is Everything is Horrible and Wonderful. It's by Stephanie. Oh shoot, what's her
maiden name?
No, her maiden name is Whittles. Watts, I think, is her last name, or Watch. Anyway, it's this comic, Harris Whittles, who passed away from an overdose a couple years ago. He was a writer for Parks and Rec and Eastbound and Down, the Sarah Silverman program. All of this.
Very funny guy.
Very funny guy. Master of none.
Yeah.
And he was just incredibly funny, but he had a drug problem, and it's from his sister's perspective, of like before and after, and everything leading up to his overdose. And I've lost friends to overdoses and whatnot, and it's just tragic, and it really does paint the picture from all sides, both of it being like you getting mad at them and then feeling bad and not wanting to enable and not knowing what to do and it not feeling real, all of that sort of stuff, along with what it's like to really grieve. And it's just a really beautiful book. And
you were reading it on the plane, and Kate would literally be laughing out loud 1 second, and then like, and I'm like, oh my God, you're going on like a roller coaster.
It's a phenomenal book. You should get it. It makes me just... I watched like all of his episodes of
Parks and Rec,
all the ones that he was credited to have written, and I mean he wrote on all of them, but the ones that he actually
the exterminator,
the animal control guy. Yeah. I watched all of his episodes too. Yeah. I was just like, damn, what a it's a good book. Loss. Yeah, really good book.
I'm gonna order it and read it because Kate won't give me her copy. Actually, no, I'm gonna read it on Audible.
There you go.
Which will be a sponsor next week or something.
I think it was last week. Audible.
Do you have any shout outs?
Yes, I do. At Rory Melville, happy belated birthday, buddy.
Was that your Rory?
No.
Oh. But also, hi, Kate's Rory.
Hey, bro. And at It's Cheza, also happy birthday, because I believe your birthday will be when this comes out.
Oh, shit.
So happy current and happy belated.
I don't have any, so...
Do you want to just wish them happy birthday?
Yeah. At Rory Melville and at It's Cheza. Happy birthday to you guys. Anyways... Guys, this is the other thing I was going to ask. I didn't ask you if we could ask this, but I'm going to ask. We need to know, would you watch this on YouTube? Or like if we just made it audio, Doesn't matter. Do you guys like watching it? If you like seeing our dumb faces and you actually watch the podcast versus just audio, write us a comment and tell us you do. Which is kind, because I don't even like looking at myself in the mirror every day. Hey, go subscribe to us on iTunes and leave a review. You can follow me at all the things at Kelsey Dara.
Follow me
At KTP on... I thought we were rhyming.
Oh, yeah. Follow me at KYTPA on Twitter and at KPeterman on friggin' Instagram if you want. You know? What does it matter? I'm so tired.
Get your coochies checked. Fucking bye!
I find the competition and I get them a taste. As soon as so mad that they're red in the face.